The South African Medical Research Council calls for accurate and timely mortality data, especially information about the causes of death. The Council is also calling for urgent inclusion of the manner of death on South Africa's death notification form. It states that the cause of death is important to monitor non-natural deaths and natural deaths. But to help us understand what existing laws say and what needs to be amended is Dr. Pam Groenewald, a specialist scientist with the South African Medical Research Council. Doctor, thank you so much for your time this evening. How imperative is the accurate recording of timeless mortality data?
Good evening to the listeners, and thank you for inviting me to be here to highlight this important issue. Yes, so it's really important to have timeless and accurate mortality data available continuously so that we can monitor what's happening in terms of mortality. I think we've all just lived through the COVID pandemic, which particularly highlighted this need. You need to know where people are dying, how many are dying. Are they dying from COVID, or are they dying from deaths due to lack of access to care, for example? Unfortunately, cause of death data is not available, but the MRC has got a rapid mortality surveillance system, which gets weekly data from the National Population Register of all registered deaths in the previous week. This is obviously registered deaths at the Department of Home Affairs. And this enabled us to monitor excess deaths. So we could see what the pattern of deaths would be from previous year's data for each week of the year. And we could compare what we saw during those COVID years and compare it with what we would expect. So that was very useful. And the National Population Register data only has data, to enable us to distinguish between natural deaths, which are deaths due to disease, and then unnatural deaths, which are the injury deaths. And as you mentioned, the manner of death is very important for the injury deaths because it tells you whether it was an accident or a suicide or a homicide or a disease. So this monitoring enabled us to see what the excess deaths were doing in the different provinces over time, and we noticed that the increases in natural deaths coincided with spikes of COVID infection. So we assumed that many of those deaths were due to COVID, but we haven't been able to see what the causes are on the death certificate, so we can't be sure. And then we also noticed, very interesting, during the alcohol bans that there was a dramatic reduction in injury deaths, which really provides some food for thought in terms of policy going forward, preventing injury, looking at alcohol use and so on. So it's really essential data to be able to plan and to target appropriate interventions and then to monitor the impact of those interventions.
But Doc, why has it never been a standard procedure for us to document deaths in terms of what the cause of those deaths are externally?
Yes, so we do have a death notification form, and there is a medical certificate of cause of death on that form where doctors will certify the cause of death. But what's missing on that form is the manner of death. Now, the manner of death, as I mentioned, is it will tell you whether it's a homicide, a suicide, or an accident, or disease, just a natural disease. And that is on the international recommendation, is that should be on the form and has been the recommendation for many years. And we have tried to with the stakeholders to, stress how important it is and ask them to include it. But while there are no sort of explicit legal there's no legislation that explicitly prevents you from putting it on there. There's some interpretative issues that have sort of hindered being able to get this achieved. Yeah.
And of course, for us to be able to get this data, Doctor, it takes institutions like yourselves to go through these processes, which I can imagine is quite costly. How is it that government is then seemingly taking time in ensuring that it's a must for those death forms to include the manner in which people have died?
Well, as you've probably read, in order to get the information that we need on injuries, the MRC has had to undertake regular, what they call injury mortality surveys. So that means sending field workers into the mortuaries, the forensic mortuaries, and collecting data, and then, capturing that data and analyzing it and writing up reports. So it's a huge undertaking, and it's very costly. Whereas if doctors were just putting it on the death certificate, those are being collected anyway. The cause of death data is being captured and analyzed anyway. It's one item that needs to be added on the death certificate. And I really don't understand why it hasn't happened yet.
Yeah, and of course, this also speaks to the Sustainable Development Goals. Which of them are important in relation to the urgent call that's made on mortality data?
Well, it's very interesting because there are quite a few of the indicators for the Sustainable Development Goals that include, that rely on mortality data, and a number of them are rely on injury mortality data. So, for example, the Sustainable Development Goal 3, which is around good health and well-being, most of those indicators are related to mortality, and there are a number that require specific causes of death. And one of the goals is to halve road traffic deaths, by 2030. So halve them by 2030. Now, if you're not monitoring them accurately, there's no ways you can track the progress to reaching that goal. Then there are, under gender equality, there's gender-based violence, with intimate partners and not intimate partners. And then in Sustainable Development Goal 11 and 13, which are about sustainable cities and communities and climate action, one of the goals is to reduce the number of deaths directly attributed to disasters. And then lastly, SDG 16, which is about peace, justice, and strong institutions, their 16.1 is to reduce the number of victims of intentional homicide. And then there's one about conflict-related deaths. And then, interestingly, the number of journalists killed per population. So a number of them are related to mortality, and I'm not sure how South Africa is going to be able to provide those.
And are we anywhere near reaching any of these SDGs, Doc?
Well, I'm not an expert on where we are, but we certainly have. There has been a reduction in it. Well, there was a reduction in homicide due to the gun control acts and, all those control interventions.
Right.
Road traffic accidents have also come down, probably due to, the road safety interventions, but we're still nowhere near where we need to be. We still, we were coming off a very high, a high level, so we have a long way to go to complete it.
And lastly, Doc, what action do you believe there needs to be taken, apart from doctors then filling out that form with the extensive information that is needed? What more do we need to do as a country in order for us to be able to get the right data, in order for us to change policy and to change legislature, in order for us to be able to reach those SDGs?
Well, we're calling on the government to take action and to rectify the situation as soon as possible. It really is not it's not a huge thing to do. Just the stakeholders need to sit together. They need to understand the implications and, that this is an important issue and make the decision. It's as simple as that, really.
All right, Doctor, thank you so much for your time this evening and for your inputs. That was Dr. Pam Groenewald, a specialist scientist from the Burden of Disease Research Unit at the South African Medical Research Council.